Welcome to the Rocky Mountain MS Center's Empower Educational Series. This series is designed to give people with MS real-life strategies to empower them to create lasting healthy habits that will positively influence their lifelong brain health. You can look for companion articles to each of these webinars in Informs magazine, published quarterly in print and digitally through mscenter.org. The Rocky Mountain MS Center would like to thank Biogen, Bristol Myers Squibb, Genentech, and Sanofi Genzyme for their support of this program. Today's topic is gratitude, perspective, and the present moment. The presentation features Meghan Smith, a licensed clinical social worker who has worked within the field since 2008. Her undergraduate work was with the March of Dimes Family Support Program at the Neonatal Intensive Care Unit, Children's Hospital, Colorado, and she earned her Master's of Social Work in 2015 from the Metropolitan State University of Denver, with a primary focus in mental health and an additional emphasis in grief counseling. Meghan worked from 2014 to 2018, creating and managing a program which focused on serving individuals with neurodevelopment disorders, such as autism and developmental and intellectual disabilities, attain and retain employment in the community. Most recently, she works closely with providers, nurses, and support staff to support our patients and their families in the Neurology Outpatient at UCHealth. She works alongside Neuro Palliative Care Clinic staff to support patients and their families in attaining community resources outside of clinic, as well as providing caregiver support, education, and counseling. If you missed something on a slide, we will be archiving this webinar on our website, www.mscenter.org, so you can replay it at any time. We'll be sending links and additional information in the follow-up email. We will reserve several minutes at the end to answer questions from the audience. You can submit questions or comments at any time during the hour by typing them into the chat window on your screen. We will answer as many questions as time allows. Today's presentation is for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. And with that, we'll turn it over to Meghan.
Hi, everyone. I'm glad that you could be here today. I'm going to go ahead and share my screen here in a second. Hopefully everyone can see me. I do have a PowerPoint so that people can follow along visually. And really, I want this to be interactive. I haven't done it over Zoom before, so you guys are kind of my guinea pigs. I apologize. It's kind of hard for me to gauge how long it'll be because of the interaction factor over Zoom. I know most people will not be on video, so it's your choice whether or not you want to chime in over chat. And I'll be looking at those throughout the presentation. Like I said, it is quite interactive. It's really exploring, reflecting, and also if you would like to write, physically write, I would suggest, I'm going to give everyone a little bit of time to get a paper and pencil if you don't already have it. Before we get started, I would suggest that. So that you can write some of the stuff down if you're choosing not to share it during the webinar. Let me go ahead and get my presentation screen up here. Like Kelsey said, this presentation is going to be on gratitude, perspective, and the present moment. And what I'd like to kind of talk about in the beginning is the fact that I really think that this could be almost for anyone, whether you have progressive MS, relapsing and remitting, or even just the general public. I think people who suffer in any way, physically, mentally, cognitively, spiritually, that it makes it more of a challenge, and I don't want to dismiss that. So first, I'm going to go over a little bit, just briefly. We're not going into a lot of depth around the 5 stages of grief. Many of you have probably heard of them, but I want to just recognize them because grief is real, and it is real within chronic disease and pain and suffering. So I'm just going to go over them: denial, anger, bargaining, depression, acceptance. This was one of the most common, this is one of the more common theories that we reflect on, but there's actually many more, and there's as many as 7 different different stages depending on what theory you're basing it off of. This is one of the more common ones, so we're just going to stick in this area. And at the end, I propose a question, and this is kind of where it might be good to jot down some thoughts. And that is, what has multiple sclerosis taken away from you? Because let's be honest, we know it's taken something away from you, whether that's a sense of security in what it might be or what it's progressed into. So now I'm just going to let you guys take a minute before I go on to the next slide, and just really think about that. This is where it might get a little bit more challenging for me, because often this would open up discussion within a group setting. But I think it's really important for us to sit and think on this. And if today isn't the right day to do it, that's okay. You can always come back to this webinar and look at it at a later time. I also want to say that if you've done this before, or you've done an activity like these before, that it's really important to know it's always good to come back to it. This is not a one and done kind of thing. This is something that is non-linear, just as in suffering and pain and grief. It's non-linear. Denial, anger, bargaining, depression, acceptance. These are things that happen sometimes on a daily basis for those who have chronic pain and suffering, and or a chronic disease. Now, with that in mind, I want to kind of talk about mindfulness in medicine. It was really pioneered by Jon Kabat-Zinn, and it says Zahn on there. That is not right, it's Zinn. He's the University of Massachusetts. He's still there. And he really discusses turning towards the pain and grief. So much easier said than done. And this goes back to what I was saying originally, that we are always in transition, and that this isn't always linear. So, but what's important is that we're aware of the pain. We know it exists, whether that's suffering with multiple sclerosis, mentally, cognitively, physically. We have these thoughts, we have blame. And so now I'm going to kind of let Jon Kabat-Zinn talk a little bit more about what I'm discussing. So hold on one second, I'm going to get to this link.
Well, nobody wants to fall into a condition where, you know, you wake up in the morning and your body's hurting, or you can't even sleep at night because your body's hurting. And some chronic pain conditions really are like that. And people who suffer from chronic low back pain, or chronic headaches, or, you know, facial pain, or whatever it is, there's so many different conditions that have pain associated with them. And then you discover what the limits of medicine are, because you go to the hospital and hoping that they'll have some special pill, or, you know, in the worst case scenario, some kind of magical surgery, and that it will just make your pain go away. And then, you know, you basically come to a rude awakening times where you discover there are real limits to medicine, and sometimes the drugs that you would take to alleviate the pain do other things to you that you just don't want to do on a long-term basis. So we see people, again, who have long-term chronic pain diagnoses and conditions, and we invite them to actually turn towards their pain, tune in to the sensations, and to stop using the word pain altogether, and or be aware of how much you're using the word pain, and instead substitute like discomfort, and then zero in, just drill down into what you mean when you're talking about pain, and say, well, like, what is it in the body? What kind of sensations are they? Are they rending? Are they pulling? Are they crushing? Are they, and there are all sorts of descriptors that actually help us to get a sense of what's called the nociceptive dimension of pain, how it is in the body, the somatic element of it. Then there's all the thoughts about the pain, like this is killing me, it's going to ruin the rest of my life. That's not pain. Those are thoughts, but they're contributing to the suffering. So we can make a differentiation between the bare sensations and the total suffering package that, to a large extent, we're generating ourselves through our thoughts and our, reactive emotions around it. Once you cultivate mindfulness, you learn to uncouple the somatic sensations from all the thoughts and emotions, and that actually, you still have the sensations, they can still be unpleasant, but the knowing of unpleasant sensations is actually liberated from the suffering. And it's just the way things are. And the more you befriend the way things are in your body, the more people find that, you know what, I'm learning how to live with this. Do I want it? No. But is it eroding the quality of my life? Not the way it was before. So you can practice this by just like getting your toe in the water. It's just like take a kind of open look at the discomfort and just feel it, open to it. Just like maybe for 15 seconds or one in-breath. Or if one in-breath is too long, try half an in-breath. And then go back to like whatever you're doing to distract yourself or think about or whatever. But then more and more, you like dip your toe in a little longer. Go a little deeper with the foot, and gradually begin to reclaim your body, even the parts of your body that hurt and that you don't want to deal with. And I'm not saying that this is a substitute for medical treatment. This is a profound complement to whatever medical treatments there are. But as I said, in many instances, there are very real limits to the medical treatments for chronic pain conditions at this particular time.
Okay. So I'm going to just go into my next video right now and try to get that up, screen shared. If it gets a little too long, I might stop it, but I just want you guys to get an idea of like a conversation that John Kabat-Zinn recently had via not a patient, but someone who was working within his mindfulness techniques. And she's somebody that suffers not with MS, but another chronic progressive disease that has pain. So I'm going to go ahead and click on that and we'll get started.
By also expressing gratitude for your generosity of your time, your wisdom. Grateful to Soren, to everybody else who's on. Grateful to you for acting as a harmonizing agent for all of us to be connecting like this. My question is actually on behalf of my mother, who's also on, but she doesn't know how to raise her hand.
Oh, okay, yeah.
So I'm going to ask. She has
It's a generational thing.
Yes, she has a lot of physical pain, back pain and other pain, and would just be interested to hear you talk a little bit about how to work with pain within the practice.
Oh, well, that's a wonderful question. And when you get, I mean, it's not just a matter of age that, from the very beginning of my work in the UMass Medical Center, I started to meet people with chronic pain conditions, some of them were, very young, some even children. But of course, as we all know, as we get older, the body goes through what the body goes through, and sometimes it's just aging, and sometimes it's accidents or injury or whatever. But sooner or later, if you have a body, pain that doesn't go away or isn't immediately treatable is going to arise. And then, so the question is then, how do you deal with it, especially if the drugs and surgery are only of limited value, or you've been that route already? and haven't gotten full satisfaction. And this is one of the most important and critical elements of mindfulness practice, has to do with the relationship of pain and suffering. So often it's a little bit of a cliche, but we differentiate pain from suffering because the pain is in some sense unavoidable. That if you break your arm or you fall down or you break your hip or, sort of hit your head, and pain manifests in a lot of different ways. It's not just all one pain. It can be many different things, and it can be from mild to horrible, acute to chronic. And then there's how you are in relationship to the pain. And while the pain may have a lot of intensity, how you hold it makes all the difference in how much it will destroy your life or erode the quality of your life, or you will suffer, in other words. And this is where the rubber really meets the road with mindfulness and it's a hard practice. I'm not saying it's easy, but when we, for instance, introduce people to a body scan and you're scanning through your body, a lot of people are in pain. And even lying down, is hard for extended periods of time. And so, of course, you don't have to lie down. You can squat, you could sit, you could stand on your head. I mean, there are a million different things that you could do to make things better, support yourself with pillows or whatever. But ultimately, you're either going to run away from what you don't like in the body when it manifests as intense sensation, or you're going to do what most of us would never think to do, and that is turn towards it and put the welcome mat out for the sensations. And then ask, I've used this metaphor before, can I just take a quick peek at it? Like put my toe in the water, just like half an in-breath. How does it really feel when I pay attention to the basic sensations? Which of course I don't want to do. I want someone to cut it out of me or give me some drug and make it go away. But it's very interesting to turn towards what we call pain, but I prefer to don't call it pain, because then you build a big story immediately about my pain and how long it's lasted and what caused it and who's to blame and why I didn't get enough insurance coverage for it or whatever it is. But then you're in a universe of your own creation that has nothing to do with what you're feeling at the moment. So you turn towards what you most don't want to turn towards, and you just kind of put the welcome mat out and just take a kind of quick sideward glimpse for half an in-breath. How is it? Maybe a whole in-breath. How is it? And what you'll find is that invariably, the bare sensation can be held in awareness. But there's not just bare sensation that creates pain and suffering. What creates the suffering is the thoughts that go along with it and the emotions that go along with it. Like, who's to blame because this accident happened and it wasn't my fault? Or, this is killing me. It's destroying my life. Okay, those are not true, those statements. Those are thoughts. And when you say this is killing me, in that moment, you could actually, and a lot of chronic pain patients ultimately wind up having to do this because there's nothing else that's going to deal with their condition. You take a quick peek and you say, is it really? And you look deeply into your back or your neck or wherever the pain is most vivid. And in my experience, and in the experience of people that I've talked with about this and studied and written about in the medical literature, most people will say, no, in this instant, not
Yeah, I'm
even
going to stop
second,
the
but in
share
this
there.
instant.
1 second. Okay, sorry, it takes me a second to get in and out of those videos, so I apologize. I'm going to go back to my PowerPoint, but I do want to let you guys know that you can always revisit this and listen more in depth to Jon Kabat-Zinn about his ideas and his practice at the University of Massachusetts and his research in the Mindfulness Institute. And just so you know, there's actually a practitioner here in Colorado who is an expert and actually teaches his philosophy and his research. I believe she's in Boulder, but she does offer classes, and I'm not sure what that looks like with COVID right now. Everything looks a bit different right now with COVID, and actually I was kind of going to address that in the beginning, so not to go backwards a little bit, but I think in some ways right now what we're experiencing worldwide with this pandemic is a major loss in itself. And if I wasn't going to address that, then I wouldn't be doing any justice. I think we all are suffering, and at some level within this pandemic, as it's taking away a lot from everyone. And and we can discuss that more as we go on, but I'm going to open my PowerPoint here. So we're going to talk a little bit about the power of perspective.
So again, real quick, I just wanted to interrupt and let folks know we will be sending out the links for those videos in our follow-up. So if you want to watch the videos in whole, and then while you're still on the subject, do you know the name of the practitioner that practices?
Yes, it's actually a woman, and I saw that question and I'm trying to remember. Let me, can I send it out at the end after I have time to like get her name and contact information?
Absolutely, we can include that in the follow-up email as well.
Okay, wonderful. I want to make sure that I'm sharing my PowerPoint. So let's get back on there. Can you see it, Kelsey, my go-to person?
That looks good.
Okay, wonderful. Okay, so this is really talking about the power of perspective and the power of this shift of powerlessness versus power. And it's been studied quite a bit, but from a medical standpoint, they talk about the focus of illness in the foreground can kind of feel self-absorbing. So it kind of provides the individual or patient or client or any person out there with an opportunity to learn more about his or her illness and effective strategies to treat and manage symptoms. So asking yourself, am I in control or am I powerless? And kind of what that shift may look like, depending on any given point within your disease. And being aware, which would go back to mindfulness essentially, but this is just kind of talking and making it literal. Like, what is perspective? It's really seeing yourself within the power or without having the power, within reason. So the power of gratitude. Sorry, my screens are a little bit backwards here. So you may have thought before, like, oh, saying thank you for someone opening the door, it's the right thing to do. Everyone should do it. It should come naturally. Sometimes we say thank you without even realizing it's coming from our lips. You know, but what is it? What is truly gratitude? And if you look here, I've written, it's really an attitude. It's a choice. It's a habit. And what can it do for us? You know, it can attract better relationships, but you have the choice every day to do it. And at first, if you're not in a place of gratitude or you haven't done it for a long time, it can actually be pretty challenging. But let's talk a little bit about what it can do. greater happiness, and this is based in research, more optimism, positive emotions, new and lasting relationships, better health, more progressive towards personal goals, fewer aches and pains within reason, more alertness and determination, increased generosity and empathy, better sleep, and improved self-esteem. So those are some of the things that have just been researched within time and recently. And actually, Kelsey, you sent me a great article that I read, and I think we should send it out to everyone because I looked it over and it was so awesome. And it really talked about recent research stating, asking people to write letters of gratitude and whether or not they sent them or not throughout their counseling, and who in turn got the most out of counseling. And it actually was proven that the people that wrote the letters of gratitude, whether they were sent or not, actually got better results from their counseling. And some of them were college students, some of them weren't. But it was just a really interesting article, and I suggest everyone read that. But it is not in here, but maybe we could put that in the links that we share. So how can we feel more grateful? You need to challenge your critical inner voice, and we all have one, but being mindful of that is huge. Act grateful and be more accepting. Practice mindfulness and awaken your sense of wonder. And I think this really does look different for everyone. So without further ado, let's go ahead and practice it now. So if you have that paper or pencil out, that would be great to have. But you can also just contemplate on it if you want. So make a list of things that you're grateful for right now. It doesn't have to be 5 things. It could be 2 things. It could be 1 thing. It could be 10 things. These can be big. So you may be thankful for your family, or they could be really small, like someone opening the door for you, like we said earlier. So just to contemplate it, write it down, whatever. Now, I'm going to give everyone a few minutes to do that. And like I said, you can always go back to this. I actually suggest people doing it every day. But I realize that that is a lot to ask of people. But if you get into the habit of it, it's wonderful. So I would ask that you reflect on your list and allow yourself to feel good about the things. So if there's one person that you could thank, whether it over email, text message, phone is even better if you can right now, do that. Even right when we get off this webinar today. It's a great way to put this into action afterwards. So am I MS? No, you're not MS. I want you to think about what MS cannot take away from you. Who you are. Is MS your co-pilot or the annoying backseat driver? And what has MS taught you? Whether you've had that diagnosis for a day, 100 days, a year, or 15 years, what has MS taught you? And also let that teacher and guide, not MS, but let the teaching guide you and how you teach others about your disease, because no one can teach better than those who have experienced it. And that's not that we would want anyone to experience it, but because we cannot take it away, what has it taught you and what can you teach others? Including me, because you could teach me a ton. I learn every day from people, and I'm so actually grateful to work with such amazing people. So I'm going to get away from that a little bit and talk about pain management clinics. Just a brief review. I mean, some of you guys may already participate in them, and some may not, but insurance typically covers it, and I would suggest it to anyone. Typically, they're interdisciplinary teams. If not, there's kind of two kinds, and this is the one that I'm much more passionate about because I see how it helps people. It's interdisciplinary in the fact that there's usually social workers, therapists, physical therapists, nutritionists, nurses, doctors. Pain management can include pain medication, but that's not the end all and be all. And they also teach us about different types of alternative therapies, and as well as having coaches to help us through that. And here are a few that are listed, like acupuncture, biofeedback, CBT or cognitive behavioral therapy, water therapy, massage, meditation. All of these things have been proven to help individuals with MS, as well as other chronic progressive diseases and mental health as well. And then we don't need to go a whole lot into this, but just tips for coping with pain. Stay active as much as possible. You know, I know at the King Center, they have a workout area that you probably can't go to right now, but what have you done in the past that have kept you moving within your home? YouTube videos, there's just so much out there over the internet now. And I think it's so accessible sometimes that it's hard for us to even get motivated to turn it on, but find one you really like and hold on to it, or explore different ones and see what that would look like in your home. Know your limits. Exercise. Make social connections, which I know some people, it's hard right now because of COVID. It's hard for all of us. But what does that social connection look like for you right now? Typically, I say Facebook isn't the best platform necessarily, but that there is a connection factor to it right now that we cannot deny, and other platforms online that you can get into, such as groups, chats, or even Zoom meetings, what we're doing right now. And even though we can't hug each other and embrace each other, which actually is very challenging for me. I'm a social worker, and honestly, I would hug everyone I could if I got the chance, but which is kind of ridiculous, but it's true. And so what are we doing now to make those social connections outside of COVID? Distraction. Oh, distraction is a beautiful thing. And it can be very effective. Watching a movie, taking a walk, getting outside, engaging in a hobby, different things that you can do within your home setting right now. And don't lose hope. And I know that's hard to say because hope looks different for different people, but it is really important that you have counseling right now. I think everyone should have counseling. That's just my platform I stand on, and I always say that. But if you can get a counselor, whether over the phone or on Zoom, and you don't already have one, reach out. Psychologytoday.com is a great resource for different therapists in the Denver metro area. You can read their bios, you can watch videos of them and see what they offer. I think professional counseling is important, if nothing else, to vent. And also, obviously, follow prescriptions carefully. So neuro palliative care is very close to my heart, so I'm just going to talk a little bit about it. So while palliative care is traditionally associated with people who have cancer and hospice, it truly is not hospice, and it isn't just for people that have cancer. Palliative care originally, actually palliative came from the Latin word to cloak, meaning to cloak the person with care. This means that it's not just a doctor and it's just not a nurse, it's a social worker, it's a psychologist, it's a spiritual care. And really working with all those different disciplines in order to give you the best care for you possible. So this field has expanded, and I'm very passionate about our Neuro Palliative Care program at UCHealth, so I guess I'm kind of doing a plug for them. I do help, but I am not the main social worker there. She actually is working remotely right now, but I am in that clinic most of the time on Fridays. But this is really about people who are struggling during their disease course. And this includes diagnosis. So like I said, whether you were diagnosed yesterday or 10 years ago, patients and families are affected by neurological conditions, and we're really in there for the long haul. And often people talk about palliative care being, you know, somebody who has cancer and is dying of cancer. This is not it. Palliative care, and the reason it's recently hit more mainstream is because of a doctor we have, or we did have, he has now moved to Rochester, New York, but Ben Kruger, and he kind of pioneered it along with some Canadians. We now have it in San Francisco, Rochester, and here at the University of Colorado. So Neuro Palliative Care assists with setting goals of care, assisting with advanced directives, and we could, I mean, all of these could be presentations within themselves. Handling issues regarding decision-making and capacity and what that looks like. But really, we want everyone's needs and families' needs met so that they're not having to face these things on their own. And actually, everyone should have advanced directives. Everyone should have these things in place, but a lot of people don't. And we really are open to speaking with families, having your family come to visits, and discussing these different things, including psychological concerns, spiritual struggles, and care transitions as well. So here's your homework if you choose to accept it. Looking back on gratitude and perspective, and maybe watching those videos again in more depth, writing a letter to MS, your perspective, your grief, your gratitude, your journey, essentially, thus far. It doesn't mean that you have to sit in gratitude while you're writing the entire letter, but be honest with yourself and reflect on maybe some of those different stages of grief that you've experienced in the past and how you saw that before and how you see it now in the present moment. So also, we have a body scan, and I don't see my link here. It might be, shoot. This is by John Kabat-Zinn, and it's a pain reduction and mental stress reduction body scan. And actually, what I was planning on doing today after our webinar here is actually send out MP3 versions. If you guys are willing to share your email addresses, if you haven't already, I can send out this guided meditation to you personally over your email address so that you have it on hand. And then if you want to download it to a CD or whatever, or have it in your phone or your wherever you keep your music, so you can use it regularly. I was hoping that I had the link, but I do not see it.
I can grab it and.
Do you see it?
Let me get it out of my email real quick.
Okay. And the body scan is about 15 minutes long, and it's 12:45 right now. And I know this webinar is supposed to go for about 30 to 45 minutes and then have questions at the end. So maybe rather than doing this together as a group, since it's kind of more one-sided with me talking a lot and presenting, maybe we can share the link and have everyone use that on their own and then I can send the MP3 out.
That sounds good to me. I'm not able to grab that link really fast, so
Okay.
we'll send it out though in the follow-up email.
That would be wonderful. I actually think it's something that we could easily do here, but because of time, maybe we should just do it that way. And then everyone, I want to send out my email address as well, which I'm going to share here. But I'm going to kind of end my presentation on this note by Thich Nhat Hanh, and it says, "The seed of suffering in you may be strong, but don't wait until you have no more suffering before allowing yourself to be happy." So on that note, I'm going to go ahead and stop sharing. And I'm going to go ahead and look at all of our chats. There's a lot over here. So Oh, I see emails coming in. Keep sending those emails over so I can send over all of this information. And I'm sorry if my connection has been weak in any way or that you missed some of this presentation. I'm hopeful that if you want to go back into it later, that maybe you will see it more clearly.
And we will archive the whole presentation and send out the links. So we will send out this specific link to everyone who pre-registered for the event. If you want the MP3 though, let us know in the chat and we will send that to Megan. And if you have questions or comments that you'd like to add, now is the time to put them in the question box. Megan, I can go ahead and get started with a couple of the ones that were submitted ahead of time if you'd like.
Okay, wonderful.
So I know you touched on this in the webinar, but maybe we could do a little focusing on what are some key things to keep reminding myself that MS doesn't control my life, I do.
Yes, and that's a really good question. And I don't know that I necessarily have the best answer for it because I think it depends on where you are within what you're experiencing at any given time. But I think one really great way to do this is, if you want an actual technique, is sticky notes, where you get ready in the morning, having yourself write these out over time, and what that looks like to you. Are you a mom? Are you a sister? Are you a counselor? Are you a teacher? Not just your professional career. I mean, you have a lot to teach as somebody who has experienced what you've experienced. And since that experience is so different for each person here, I think it actually is a really good reflection technique to do on your own. And then put that on a sticky note. Keep a journal, writing it, speaking it. Actually, they've said that speaking something out loud, your brain actually hears it back. And so if you know you're an artist, or you're a giver, or you're a lover, what are those things? Speak it out loud and hear yourself say it back, because you'll believe it. Just the way you would believe it if you say, "Oh, I'm so stupid." Okay, I've actually done that before. Many of us have, out of frustration at ourselves or someone else. But to speak who you are outside and hearing it back can be very, very healthy. Or to your dog or cat, if it makes you feel better. They are good listeners.
Awesome. We had a couple of questions relating to both gratitude, and I'll ask both of them at once. So we had a question about, is happiness, contentment, and gratitude a choice? Actually, I'll stop there.
It is a choice. I remember, yes, so with this question, it's great because I think it had mentioned, if someone else didn't mention this before, is it okay to be angry and have these feelings and still be able to be grateful, if I'm remembering correctly.
Yep, that was the other question.
What's that?
That was the other, was will practicing gratitude prevent you from feeling your real feelings or experiencing?
That's right. That's right. And the answer is no. The answer is no. Gratitude cannot take away the feeling of anger or resentment or any other feelings that are natural to the human body and the human being, whether it be your soul, your brain, or anything for that matter. You are, if you have anger, you are not anger, but everyone experiences anger. The problem actually with our society today is people don't know how to direct their anger because they've been taught that anger is not okay. In which case there's a lot of guilt around anger. But I've experienced anger. Actually, I experienced anger on I-70 yesterday. So, I mean, we're all human, right? And often actually we have this discussion in Neuro Palliative Care amongst professionals because we are all human. Your doctor's human. Your therapist is human. Anyone you work with is human. And so we experience these emotions, but we're taught to not have them. Gratitude is different than experiencing emotion. Gratitude is telling us that no matter how angry I get, no matter how sad, no matter how much suffering or pain I have, I can always find something or someone to be grateful for. So it's a frame of mind, but it has nothing to do with anger or pain. I mean, it does because it can help us, but it's not directly related to it in the fact that they're mutually exclusive. I don't know. I hope that's making sense.
Yeah, absolutely. So we've got a few emails in, so we will make sure to get those to Megan for the MP3. And the last question was just a request to include a reflection exercise, which I really like the one about making sure you say things out loud so your brain can hear them. But if you've got any other last reflection exercises or exercises that you can send, and then we will close the questions.
Okay, so I'm gonna just go back to the homework assignment, and it's obviously up to you, but I highly recommend writing a letter to MS. It's a great way to reflect your journey as a person, where you are with the disease and how it's impacted your life in a positive and negative way, and whether or not it's defining you or not.
Awesome. Well, thank you so much for your time today, Megan. I know you guys are really busy over at the clinic, so we really appreciate all that you're sharing and seeing that this was helpful to folks both in professional and also personal capacities. So thank you very much. And thank you all for tuning in, and be on the lookout for that follow-up email with all of the links.
Yep.
Thanks.
Thank you.